Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. Abdominal pain. What do you think of? Well, constipation is the leading cause. But according to a report out of Digestive Disease Week media briefing, colorectal cancer is on the rise for kids. Yeah, you think of colorectal cancer for adults, and that's why they do the colonoscopies. That's why they check the blood for the stool. But we have seen an increase, especially in the 40 to 44-year-old range, and this was the first one that I had seen where they were actually talking about 10 to 14-year-olds, 15 to 19-year-olds, and 20 to 24-year-olds as an increase over the last 20 years. Now, we're not talking about much, so don't get too worried about it, but there are a few things for you to keep in mind. Number one, if there's any family history for colon cancer, and especially for polyps, you bring that up. Number two, ask your children about their bowel habits. Are they having any constipation? Because constipation is a sign of colorectal cancer. Also, blood in the stool or bleeding from the rectum. Now, if you have constipation and are passing a large stool, you can have blood from that, from a tear. And that's not the same thing. How about diarrhea? Yeah, that can be a sign of colorectal cancer, but it also is a sign of constipation. You have a hard bowel movement and you have the softer stuff above and it's oozing down. How about fatigue? Feeling like you need to have a bowel movement that persists even after you've had one. General weakness, pain or cramping in the abdomen. Light weight loss. These are all things that really don't necessarily go along with constipation. So if your child has any of these things, the first thing's check and make sure that they aren't constipated. And if you can't get it under control or you are not sure, you need to go and check with your doctor to be sure you're not missing something. The important thing is have a great diet, drinking a lot of water, and give that kid a hug.